Hi, this is Dr. Nagendra Sardeshpande, and we were talking about uterine abnormalities. So last time we talked of the septum, and now today I would like to talk about a very interesting abnormality called as a dysmorphic uterus or a T-shaped uterus. It has been recognized internationally now since the past decade or so. However, we have been doing this surgery for this for the past probably 2 or 3 decades in India. Now, what is a T-shaped uterus? Normally, the uterus, the uterine cavity, is in the form of a triangle. It is of like 2 side walls and 1 horizontal upper part. So it is like a triangle. However, in a T-shaped uterus, the side walls are convergent. They are not like this. They are straight, literally. It is like a tubular cavity. Normally, when we see inside the uterine cavity, it opens out as we go up. Here, it remains like a tube, hollow tube. And at the top of that, it suddenly becomes like a T, the cavity. Why is it something which we are recognizing today? Because we today realize there are various factors how it works. Maybe it has poor blood supply, maybe increased contractions of the uterus, maybe poor development of the uterine lining or the endometrium, etc., etc., etc. But we have realized that this is a common cause. If having a T-shaped uterus can be associated with recurrent pregnancy loss or recurrent miscarriage or recurrent abortions, and typically these can occur in the second half of the first 3 months, that is about end of the third month, and in the second trimester, that is 4 and 5 months. And sometimes it may even be associated with a weakness of the cervix or cervical incompetence. Previously, now what is the cause of this? Why are we seeing this nowadays? We really don't have the answer. Previously, this sort of appearance of the uterus was typically associated with a drug called as diethylstilbestrol, which was used in the 60s for severe vomiting in pregnancy. And the children born, the female born to that lady, used to have uteri with these abnormalities. But however, that has been banned for more than 50 years now. So we really don't know. Maybe it's genetic, maybe there are some pollutants in their environments which is causing these abnormalities. We really don't have a clear answer. However, treatment of this abnormality is simple. I still remember my early cases which I had done, and the results were absolutely miraculous. Patients coming with multiple abortions and sometimes even not getting pregnant for some reason. When we just put in the hysteroscope, like last time I discussed, we cut the septum putting a scissor or a cautery or a current. At the top we cut to open up that upper part of the uterus. On the side wall we give cuts along the side walls to open up the uterine cavity. And we have done 3D ultrasounds, we have done x-rays of this woman after the surgery, maybe a couple of months later, and we have found absolutely wonderful, absolutely normal cavities. And then the pregnancies that occurred after this procedure were amazing. We were really not sure when we started doing these procedures. We were really not sure what to expect, whether it will work, not work. But sometimes in patients with recurrent abortions, the pregnancies used to go on till near term. And patients who had not become pregnant, who had been treated with test tube babies and other infertility procedures, who had essentially otherwise a normal tubes and normal ovaries, used to suddenly conceive like this, and wow, lovely pregnancies. So then we realized that this was a very important abnormality which fortunately has been recognized today internationally, and the treatment is so simple, and the results absolutely astounding.